we bring food habits, and people like to eat foods from different countries. When I first moved to Washington in 1979, we had in DC a very large Ethiopian community, and we have a lot of Ethiopian restaurants here, probably more than in other places. In 79, we had them, we still do. So I think immigrants bring their own food and cultures, and and we need to celebrate culture. It's not about being culturally competent. I hate that word because I used to say culturally competent, the least competent person always thinks that they're competent and they never go to the training. Okay, so I like to think this culture is something which you want something to be culturally meaningful, and food is a very meaningful way to engage with other people.
Welcome to the Immigrant Nation podcast. I am your host. My name is Martin, and today we have the fantastic Dr. Janelle Delgado. She is an immigrant pioneer, healthcare public policy, and mental health advocate. Born in Cuba and migrated to the US, she is also the president and CEO of the National Alliance for Hispanic Health. She has dedicated her career to eliminate health disparities and empowering underserved communities. With a PhD in clinical psychology and a Master of Science in urban and policy in sciences, Dr. Delgado played a key role in shaping groundbreaking reports like the report of the Secretary's Task Force on Black and Minority Health. A renowned author of the Buena Salud Health series, she continues to be a fierce advocate for accessible, cultural, competent healthcare, making her one of the most influential Latino leaders in the US. Dr. Delgado, in 1985, you were the Special Assistant on Minority Affairs and was a policy staff member on the 1985 report for the Secretary's Task Force on Black and Minority Health. What were your observations in the report then, and what observations are you observing today that are still continuing to plague minorities and especially the Hispanic community?
Well, I think the most important thing is that we knew then that there were major issues among the different communities, and they varied. We knew, for example, that Asians live longer than non Hispanic whites. So, because of that, they weren't covered so much in the report. They're included there, but the report dealt with excess deaths. So, since they died much later, they didn't have excess deaths. When it came to the Hispanic community, we didn't have any data on mortality because it wasn't collected at all then. So we didn't know how long Hispanics lived or anything. Once we had that data, we found out that Asians and Hispanics actually live longer than non Hispanic whites, while the Black community and the Native American community live less. So, over the years, what we have really focused on is you need to address each community with their unique problems. And that is key because Asians and Hispanics, I say we live long and suffer. So we are more likely to have chronic illnesses, while the African American and the Native American community have diseases which, terminate their life early. So I think that it's the quality of life for everyone, which we and myself throughout my life has been concerned about. I want everyone to be in their health outcomes better than the best, not comparing ourselves to non Hispanic whites. That's a real mistake that we do because sometimes they're not better than the best. Sometimes they're like in the middle. So using them as a standard is not a good idea. So there's lots of richness in data. We knew way back then that regardless of income that black women had a higher rate of infant mortality than other women, and it's not like uh, issues of people's race and ethnicity are new now. They've been long-standing. But what is going on with each person, with each community, that is the richness in health. And this idea that non-Hispanic white men, that their data applies to everyone, is not only bad for everyone, but it's also bad for non-Hispanic white men because their health, they still live less than women. They still have all these health issues, and probably because we didn't study the other communities where there's a richness of data and experience and a wealth of knowledge that we can share for everyone to make everyone's life better.
Very interesting. So, if I can peg onto that, um, uh, lately in politics, there's been conversations of immigrants bringing diseases in America, and obviously uh, it's targeted to a certain group for a certain reason. Are there any reasons as to why we should be concerned about migrating to America or migrating to any country across the globe and migrating with certain diseases into those countries?
Well, actually, the other reverse is true. What the data show is that immigrants actually are robust, they have good health, and they come to the US and to other countries to 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 work and to build a new life. You need to have a certain amount of health and stability to do that. Unfortunately, what is happening is around the world, there aren't enough workers, and people need immigrants in order to sustain the life that they now have. And I think that is what we have to focus the richness, the wonderful things that immigrants bring. On the other side, immigrants also have to know that they have to marry the different cultures. You just can't hold on to everything from the past. Every culture has good things. So how do you make a new thing that is wonderful? And that I think is what is usually the American experience. Right now in the US, salsa outsells ketchup. And salsa is not, something that came from Latin America. So I think that that's just in food, but also in values. One of the things that immigrants bring to the US is a strong sense of family and faith. And those things over the years, in the US at least, they're not as strong as they used to be. And I think the strength of that I see in immigrant communities, regardless of where they're from, is that sense of belonging to a community, helping each other, supporting each other's family, bringing a faith practice that builds community and family and health as a result.
So that's really cool that we immigrants are able to still stay together and do things together as a tight knit community. Do you think that is a negative when it comes to adapting to the countries we've moved in, or does it also help us economic wise?
I think that you have to do both. If you go to a new country, you have to adapt to their culture and see what are the things there that sort of you can build on. You just can't take what you did someplace else and say, I'm going to do the same things in this new place. If you're in a new place, you have to adapt to everything there, the food, the places of worship, the styles, and hold on to what is important for you. It's very, very hard to do that. The the Even the term that used to be used was acculturation, and that used to mean that you gave up your culture and adapted the new culture. But in the more modern meaning, acculturation means a blending of the different cultures and values. And I think that's where it is difficult because everybody likes to hold on to what they know. But part of going to a new place is experiencing and building on the richness of that place.
So earlier you touched on something that is very interesting to me, and researching you, I realized you also had put in a lot of work in this area, and that's mental health. Immigrants today are struggling with mental health across America and across the globe for a variety of many reasons, and so. In the dynamics that affect immigrants when it comes to healthcare, social services, and on and on and on, how should they cope with with mental health?
Okay, so with mental health, the reality is that the first immigrants, the first generation that come here, do much better than the first generation that's born in the US. And the reason is that the first generation that comes, they still have those values of family and faith and friends. The first generation that's born here, especially among our young people, they have to marry the different cultures. I mean, it's hard enough to be a teenager and go from being a child to an adult. Imagine if what you have to do is blend the culture of the home with the culture of society. So, in terms of mental health, we have to look at who are we talking about. Also, one of the things that happen that there are some traditions which are very important. Taking care of the older people in a family is something that many cultures do. But in the US, with the mobility and all these things that have changed our society, where families don't stay in the same community, taking care of elders is not seen as something which is doable. So you have an increase in the need for nursing facilities and things like that. And many times I find that in immigrant communities that the mental health issues that arise from all these changes are things that they need to talk to someone about. Now, some of the depression and stress that immigrants experience is very
Mhm.
real, and you have to be able to help them to not reduce stress but eliminate. It's like I tell people, coping is a short-term strategy. It is not a way of life. Okay,
Yes.
so you have to eliminate that. But after a while, when a person is sad for more than 2 weeks, or they're crying all the time, or they're having really difficult issues, you need to seek professional help. And professional help is something that people can seek and they can get help. Now, in mental health, at least we have the ability to have more mental health providers who have access to other languages. Either they speak it themselves or they have services that can help. But I think that that taboo across all societies is still very prevalent. The idea that, oh, I have to do it myself. I can't go outside my family, that's prevalent. Even among non-Hispanic white Americans, the issue of stigma is still big.
Very interesting. So we have, and I hate to put it this way, but I've observed what I'm observing today in America, in France, and I also observed it in Italy, where there is a division of immigrants based on what their status is or how they migrated into the country. Do you think our social systems at the moment, uh, as we're speaking, are designed to cope with the influx of undocumented immigrants and the stresses that are going through them? And how should the states and governments cope with the mental health associated with the stress of not being able to have a place you can really call home, the stress of not having revenue coming into the house, and on and on and on?
Well, I think first of all, you have to deal with the post-traumatic stress of the voyage from one country to the other. I mean, that's huge, and that leaves a mark which is in somebody's spirit, in somebody's mind. And in fact, we don't have enough capacity to provide mental health services to people, and we don't have enough knowledge of how to help people who come under different um, circumstances. So, in the United States, whether you came as an immigrant, a refugee, an undocumented person, or a legal immigrant, all those factors impact on how you interact with the systems. On the other
Mhm.
hand, people treat you in a certain way, with a very negative way. And I think in France, Italy, Germany, Spain, there are people who are trying to solve this, while there are other people who are saying, "Oh no, we can't have this." But the reality is that the world is changing, and adaptation is key. And how we do that is going to take time. We don't have all the answers now. And the humans, and just providing housing is not enough. That is not enough. And providing housing and food, yes, those are basic things, but we need a lot more if we're going to really help people adapt. Learning the language of each country is key. But there's a lot of data that shows past age 12, it's very hard for someone to learn a language. So, how do we help them be part of a country if they cannot speak the language? These are challenging questions. This is not, a lot of politics runs on slogans or statements. But
Yes.
solutions can't be slogans or statements. Solutions are more complicated. And that's why the work we do at the Alliance to try to help the different communities around the country resolve their issues in their way is what is most difficult to do. Because often everyone wants a cookie cutter. They want the answer and to apply it in every place.
Yeah.
And when people ask me, well, what do you do? I said, "Well, in different places you do different things." They go, "Well, how do you know what to do?" I said, "Well, we do what works in different places." That's not the answer they want. People want a quick answer. Well, we provide them housing and food. Housing and food is a basic, and as human beings, we all need that. But there's also a lot more we need. And that's where, I am hoping that the faith communities can help lift people, but also connect them to each other. When faith communities separate people from each other, that's not a good thing.
Before I delve into some of what you've achieved in the past, tell us what you're working on now. What is your main focus at the moment?
It sounds pretty boring, but one of the things that we're working on, which is very important to us, is to make sure that data on health in the United States is collected and analyzed using the new categories the government has assigned. So it's by race, ethnicity, and gender, so that we can know really what's happening in communities. For example, until this year, if you were Egyptian, you were considered white. But now we have a category called Middle Eastern North Africa, and we have different categories for people so we can know more about their heritage because we understand that in health, heritage matters. And not, everyone who's non Hispanic white is not the same. They're all different and they have different cultures and values and health issues. So we're trying to make sure that we know what we need to know about people so we can help them live a longer and healthier life. So it's a very big thing, but
Yes.
it's a battle because a lot of people who do the research, develop the medicines and the drugs say, "Oh, that's too much work. It's so complicated." It's not so complicated anymore because we have the technology, we have the means for analysis and things like that. The issue is that people have to go out and do things in a different way. We also know that this is also by gender. We have very little data on women, and we also have very little data on people who are over 65, even though people over 65 are the ones who are more likely to use healthcare or take on the average 7 medicines or more.
Okay.
So it's a basic thing. So it's include each of our communities, not only in the data collection, but in an analysis so we can get the treatment and the care we need. And so we can track what is going on. So if a community is not getting served and the issues are not being addressed, that then we can do something about it. But if we don't know, we don't know.
So there's a lot there to impact, but if we can look at what you have done in the past, and especially if I want to focus on this particular question on your book series, um, part of one of the things that for me at least, found to be interesting was you while you were addressing the Latina community, you juxtaposed the use of, and I believe this is a really a strong. Observation in the Latina community, the difference between using folk healing and modern Western medicine. Where do you think we are at the moment in those communities?
Well, what we know, and it's interesting that you asked that because I just did. an analysis that it seems that all communities in the US use what we call care or integrative medicines or complementary alternative medicines. For some reason, if it's in Hispanic or Black communities, it's called folk medicine. It's the same thing, it's alternative medicines. And the bottom line is that most people really don't want to go to a doctor and they want to take care of it themselves. So they look to see what's available and do it. The problem with that is that there's a lot of garbage out there, and people now with the internet think that something is real when it's not. So I think something like 30%, over 30% of people in the US, regardless of race and ethnicity, use alternative medicine. And all you have to do is go to some stores that all they sell is supplements and things like that to know that the reason they're in business is because people want to find another way to heal themselves. So this is not new. I think in many ways, when people talk about folk medicine, they try to diminish what other communities do. And what I say, you know what? It's all alternative medicine. It's all integrative medicine. It's all complementary and alternative. Whatever little name you want to use, we all use it because we want to take care of our own problems. We want to do it in the least costly way, and also for a lot of, especially low income communities, going to hospitals and doctors was always trauma. It wasn't like, a nice experience.
Dr. Delgado, was the trauma because of language barrier? Was the trauma because of prejudices? And does that integrate anywhere with mental health?
All right. The trauma is it's no one thing. It's all those things. It depends who you go to see. But
Mhm.
also part of the trauma is the reality is when I was growing up, we knew if you went to the hospital, you would die. Okay. And the reason that was because people waited so long to get for health care that by the time they went to the hospital, they would die because they hadn't taken care of anything in the past. So, that is trauma, but it's trauma based on the reality of people not getting care. The second thing is that for decades in the US and around the world, healthcare was one size fits all. This is what you do for everybody. And we know that doesn't work. Okay. And we also
Yes.
know that so the bias also was, I think it's more than race or ethnicity. I think that for many years, people didn't listen to the patient. So whoever walked in, if you said, oh, this hurts, or oh, that hurts, you know, the healthcare providers were focused on one thing that they knew, and that was it. But now we know those things are changing and how we treat people is changing. It was only in the last 10 years that we realized that for women, the signs of a heart attack may be different than for men. Now, women have been around for a long time. So it's not like we just arrived, but for
Yeah.
all women, this is a new situation where the signs of a heart attack for a woman can be very different than for a man. So now we have data and people are analyzing and saying, wow, we thought she was having a mental health issues, but she was really, her pains were real and they were in different places. She was having a heart attack. So all this changes over time. Now, when it comes to mental health, it's even worse because a lot of the nuances, because mental health and culture are not just near each other. Within mental health is culture because culture defines how we see the world, and our mental health is part of how we see the world and how we deal with it. So it's challenging, it's work, but I can tell you it is very, very rewarding when you can help someone get through trauma. And it takes a lot of work and a lot of patience. Doesn't happen in one session or one intervention. You feel like you've made a difference. And to me, that's what life is about. It's not about, having two homes and lots of, houses with 15 bedrooms or all that. It's about, did I make a difference? And that to me is what's most important.
Talking about making a difference, let's talk about sexual health, right? There seems to have to be this stigma within immigrant communities of on contraceptives and reproductive health. What challenges were you observing then because of our cultural norms, and what challenges are you observing now that immigrants need to be aware of?
Well, first of all, early on, we were one of the first organizations to talk about HIV/AIDS. And when I did, members of my own community were very angry at me because they, why are you talking about that? Why are you even saying the C word, condoms? And I
Mhm.
said, because I want people to live long and I want them to be healthy. So I think part of it, and that has sort of changed over time because unfortunately, if you look at a lot of the television and not television or media or TikTok or anything that's geared towards different communities, it's practically like soft porn if you turn off the volume. So,
Yes.
on one hand, we're telling people, "Oh, sexuality is a is something that you have to be very careful." But on the other side, all the visuals and the media and some of the songs, like the one that was popular in 2021 and made it to number one, uh, sort of push another message. So I think there's a dichotomy. You tell people, oh, sexuality, blah, 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 you have to be careful. And on the other hand, you're pushing it in ways that are not safe and responsible because I don't see people talking about the risks of having many partners. Many partners is not a problem if you're protecting yourself and your partner. So we always say unprotected sexual activity. Now, the bad thing that has happened is that we have rates of syphilis in the United States that's going up. We have gonorrhea that is not amenable to treatment. So people have to be very thoughtful and caring. Or even something like mpox. People think, oh, well, I took the vaccine, therefore I don't have to worry about anything. Well, there are a whole lot of things you have to worry about. So be thoughtful about your partner and yourself. So these are clear messages we have to give. And we have to give them to the men and to the women. Too often, we give messages to women. I said, hey, they're not there by themselves. You know, they have a partner, they have to get it too.
Talking about pushing the wrong agenda on social media, the Surgeon General here lately has suggested that social media is becoming an issue for sexual health and that there should be some regulation to protect, especially teenagers on social media. Um, how are your organizations working to collaborate with social media agencies to be able to curate, or working with the administration to be able to curate ways to protect our teenagers from the influences of social media, which really are mostly sexualizing our teenagers in ways that we did not foresee?
Okay, so I think that sexualizing teenagers is something which is not new. It's been going around. Only our tools now are able to amplify it a lot more. One of the things that we did actually, we worked with the Carter Center in Atlanta, and we developed a a webinar on misinformation, and this
Mhm.
is actually meant for families and for children. And if you wait, and the website is waittoclick.org, and it's available in English and Spanish to get people to think more about what they're seeing. And with young people, they need to see that a lot of the stuff that's out there for them is there to hook them. It's not really to be helpful. So I think part of it is giving people a different framework. So wait2click.org was what we did. Wait with the number 2 click.org is very important because that's a way of telling people, you know, don't just click on something just because it grabs you, because that's it uses your brain against you, and that's what that whole thing is about. So while the Surgeon General, what he's saying is important, that's just a little piece of it. It's a much broader problem because we can say, oh, teenagers are at risk, older people are at risk too, and middle-aged people, all people. The only ones who are not at risk are dogs and cats because they don't watch social media. Although I understand from some friends that if when they put a dog show that their dog loves to watch it, but they can't respond. They can't do certain things. So I tell you that it's something across the board. I have a friend who was a mentor and a politician, and I was lamenting to her how things had changed since I first came to Washington, where people would work across party lines and come up with things. And she looked at me and she said, Jane, politics haven't changed since Caesar walked into the forum. And I thought, wow. And then she added, what has changed is that the internet has changed everything. I think that's what we have to see is the internet, AI, fabulous tools. We use them all the time, but like any tool, it can also be harmful. So how do we control it? How do we use it? That's in everyone's hands and responsibilities.
You are usually engaging with large groups of people, and sometimes you give public talks. When you engage with a group of immigrant parents, how are you helping them be able to cope with everything going on in their lives, and especially things that are affecting them not just financially but also affecting their relationship with their children?
Okay, so one of the things, it depends what state you live in, because some states are more welcoming to immigrants than others. So knowing what are the resources available in that state is very, very important, and what they can avail themselves of. We have a toll free number 866-783-2645, where people can call us and ask for health information. If they give us their zip code, we can tell them where to go, close to them, stuff like that. So I can give them that information, but really, what a lot of the parents that I talk to want to know is that we're there with them, that we care about their issues, and we're trying to work to make their life and the life of everyone better. In 2015, my board changed our mission from improving the health and well being of Hispanics to best health for all using the Hispanic experience. Now, what does that mean to use the Hispanic experience? In a nutshell, Hispanics have all these risk factors, poor, less educated, don't have health insurance, are overweight, have diabetes, but on the other oh, and have heart issues. But on the other hand, we live longer than non-Hispanic whites, and we have less heart disease as a cause of death. So we must be doing something right. So how can we use whatever we're doing right and help other communities? Because if we only help ourselves, we're helping nobody. We have to help others. So my board nearly 10 years ago decided we really have to work on lifting as many other people as we can.
So, when 2024, it's an election year, given your experience with organizations like the US Department of Health and Human Services, uh, given the fact that you live in the leading city or state in the country, Washington, D.C., what public policies do you think could be implemented to improve healthcare access for undocumented immigrants? And what conversations are you having with policymakers, and how is that affecting how you're speaking about how immigrants should be voting?
All right. So, one thing to be certain of is that a lot of times what you read in the press doesn't get the details that are necessary.
Important.
So, for
Mhm.
example, when Obamacare, the Affordable Care Act, was passed, it was passed, and in it, it said that all people should have access to the health exchanges to buy health insurance. They're not government subsidized. But when the Department of Health and Human Services implemented the regulations, they made it that you had to be documented in order to buy on the exchange. We were opposed to it then, and we wrote letters to President Obama complaining about that, but it held. So one thing is to allow anyone who wants to buy on the healthcare exchanges. That would be a major win for everybody. And people said, "Oh, how are you going to let undocumented people buy?" I said, "The same way you let them shop in your stores, buy your products, and do it, and go to Costco or wherever they shop. It's the same thing. You're not subsidizing, you're letting people buy something that they need. And if they do that, they'll have healthcare coverage." So that would be one thing. The other thing is, frankly, our system needs more resources. Our population is getting older. We do not have the people power to provide services, and everything is changing in how we provide healthcare. The fact that hospitals are now looking at the model of hospitals in the home. Instead of having people come to the hospital, they will be monitored and taken care of from home. There are a lot of changes going on. And I just want to make sure that our underserved, understudied, under resourced communities are included.
That being said, you've advocated for the use of both traditional and Western medicine and addressing healthcare needs. Um, do you believe that immigrants are open to the idea of intermarrying both traditional medicine and also what in some circles we consider Western medicine?
Yes, I think that everybody wants to live long and be healthy, and people are willing to try all sorts of things. It was amazing to me that during COVID, I mean, we learned a lot. So people who were reluctant to get the vaccine were this often people who would take a medicine that was meant for animals. So I think that it depends who gives the message. So we have to have people who are trusted in communities to help each of our communities understand what's going on. It's not the time when you can have mass media messages. Those days are gone. And you can have big numbers and say, "Oh, I reached 5 million people, or I reached 10 million people." But reaching them and having them actually engage and do something, that is one to one. And you have to be a trusted communicator in order to do that. And that's why, Martin, we fund a lot of community health workers, because we know those are the people who live in the community, who know the community, and they can relate better to the people who live where they live. So at the Alliance, what we do is, like, in 2022, we distributed $11 million to community based organizations because we had it then, because the government had a competitive grant and we won it, to help them work with people in communities to inform them of what they needed to know about vaccines.
Okay, very interesting. How did COVID change the dynamics of how we administer medicine in the US?
COVID had a lot of horrific effects, but the one thing that it did, which was positive, was to speed up the use of telemedicine. And that is very important for rural areas and underserved communities. So I think that is what it did for one. The second thing, at some level, it also made people aware that we are dependent on each other. And I think sometimes people think that they do everything themselves, and you don't. You rely on other people in ways that you may not know or even want to acknowledge. So I think COVID changed that also. The third thing that COVID changed was our view of what's important in life. And that has been major. So a lot of people who were working to do things to earn money to buy the next BMW thought, that's really not important for me. What is important? So, in many ways, COVID made people reassess what was valuable in their life and what was not so valuable. I think it was a real. We had a major shift in society in a very
Mhm.
short time. We're still trying to get used to it, and like people said, "Oh, it's back to normal." There is no normal, and there is no new normal. It's just the evolving way of life. Things change. It's that old saying that you don't step into the same river twice because it's always
Yes.
moving and life is always
Yes.
moving and progressing, and we have to move too. It's like once one of my mentors said to me, I've had wonderful mentors, said to me, Jane, you don't have to change, you can be obsolete too. So I think that in reality is we all have to change. We have to move forward and we have to take the good with us and the bad, and there we have to let go.
You've had significant influences in life, and I'm so glad you touched on the idea of having wonderful mentors. There is people who are watching and listening to this conversation, and could you speak to the power of having mentors and why this is necessary in the evolution of who we're becoming?
Well, I have to be honest and say that I am very blessed that for the first 40 years of my life, I had a fabulous mother who taught me everything I know and gave me the values that sustained me through all sorts of changes in my life and the world around me. And I think having that is key. But some people may not have a mother, but they may have someone else near them who has that role, who nurtures them, who loves them, who teaches them how to look forward. Everyone needs it. You can't do it by yourself. And anyone says, "Oh, I did it all by myself," it's being very um, obtuse. Because if you think you did it all by yourself, you're very much mistaken. Because there are always people around you, above you, below you, who help buoy you to get you to wherever you get.
I am so glad you said that. So let's pivot a little bit. As a member of the Bank Inter's Future Trends Forum, um, technology is playing a significant role on what future medicine is going to be like. And you've talked about telemedicine as it's coming in. And there's also another conversation I've had in the past where they talk about remote health monitoring. What is the link between the two, and how should people start prepping for what and how to integrate with technology as a way for us to get healthcare into our homes?
I think that that's going to happen more and more. You know, I want to, I don't want to say in the old days, but in the old days, if a woman wanted to know if she was pregnant, she had to go to a doctor, right? Now she can find out at home. In the old days, when a woman wanted to know if she was fertile, she had to go see a doctor, and now she can tell at home. So I think that that's more and more we're learning a lot of the things that would see a healthcare provider for that we can monitor and do at home. And what telehealth will do is provide that information so that if something is wrong or you're having some sort of episode, that you can get the care that you need when you need it. So part of it is understanding that we can have a lot of information about ourselves and use it to move forward. And it's learning. It's learning a new tool. So it's going to take time, and we have to help other people adapt and adopt it as soon as we can.
Earlier, when we started to chat, you expressed concern about things that are happening in the globe currently. If we can zero down to America, in the last week we've had a horrific hurricane that has devastated the northern part of the state of Florida, and it has gone on to Tennessee, South Carolina, North Carolina, on and on and on, with over 1.5 million people without electricity, and looking at how communication has been. such a big issue. This reminds me of Katrina and how we went for about 4 days without any significant event happening and led to multiple people losing their lives. Do you think, based on what you're observing at the moment, that the middle states in the South, so North Carolina, South Carolina, Tennessee, had prepared their populations on what was coming, or were they not aware of what a hurricane can do?
I think that there's no way to prepare for what a hurricane can do if you've never had one. So,
Yes.
for example, one of our staff people who lives in North Carolina has now moved someplace else, and he let us know, we've never had a hurricane here. So you can prepare for something you've never had. But on a whole, I think one of the things that all people have to be more prepared for is that climate change is real,
Mhm.
and we can't predict the future just on knowing the past. That there are new experiences. You talked about the hurricane, but about five, maybe 6, 7 years ago, no, 10 years ago in
Yes.
DC, I live in Washington, DC, I didn't have power for a week because of a snowstorm. So things are changing. How, my husband, because, we're a family who likes to eat, the one thing we had a backup generator for was our refrigerator. So, so we had that, and some of our neighbors brought like some fish that they had frozen that they had caught, and they we put stuff in our freezer and stuff and for them. So I think that it's you can't be prepared for everything, but there's some things that people need to have, and that is most people need to have some sort of emergency kit that they can use if they have to leave their home suddenly for whatever reason. And that would be a good practice for everybody, regardless of where you live. If you never use it, great. But if you have to use it, you'll be very grateful to have it.
Very interesting. So I'm glad you went to my favorite topic, which is food. Immigrants have a diverse taste or a variety of menus when it comes to food, and immigrants have changed how we eat in America. I mean, you earlier mentioned the salsa being a bestseller compared to ketchup. That was very interesting. Um, do you think, as we're migrating into other countries, the type of food we're bringing in, is it affecting how we're integrating with what we're eating in our new countries, and is that affecting our health?
I think that, of course, we bring food habits, and people like to eat foods from different countries. When I first moved to Washington in 1979, we had in DC a very large Ethiopian community, and we have a lot of Ethiopian restaurants here, probably more than in other places. In 79, we had them, we still do. So I think immigrants bring their own food and cultures, and and we need to celebrate culture. It's not about being culturally competent. I hate that word because I used to say culturally competent, the least competent person always thinks that they're competent and they never go to the training. Okay. So
Yes,
I like to
yes.
think this culture is something which you want something to be culturally meaningful, and food is a very meaningful way to engage with other people. There was a wonderful person named Anthony Bourdain who would travel around the world and taste different kinds of foods. And I remember being at a conversation that he had with like 200 people. And he said, when you go to another country, you taste the food because you're polite, but you have a second taste because you want to show the people you value them. So when we come to this country, we bring our foods, and people need to take two bites, one to be polite, but a second because they value us.
Very, very interesting. So, tell our listeners where they can get a hold of you if they want to reach out to you for help or whatever reason they may want to communicate with you.
Well, if they want to, the best way is by email, and they can email me at jdelgado at healthyamericas.org with an S, healthyamericas.org. Or they can also call our helpline, 866-783-2645. But I would encourage most people to look at wait2click.org. Wait, the number two, click.org. So people can start to think about the information that they're getting through social media and the internet and know how to avoid having your brain hijacked by people who may not have your interests in mind.
Dr. Jane Delgado, I have an interesting conversation I want us to pivot into as we're getting to the top of the hour, and that is weight. Majority of America today, or two-thirds of America, are considered overweight. What is the solution, ma'am?
Ah, I'm so happy that you brought that up. Okay, so first of all, people who are overweight live longer than people who are normal weight. The people who have
Oh.
the health problems are people who are obese. Okay, and obese, I hate that word because you're
Mhm.
never going to attract anyone to a workshop that is about being obese. You have to say being healthy, excess weight, whatever. But when they give the numbers, they combine the overweight numbers with the obese numbers to say all these people. But if you look at the actual CDC data on mortality, you'll find that overweight people live longer than normal weight people, and obviously longer than people who are obese. And when most of the illnesses in obese is for people who are in obese category 3. Now, backing up quickly, about 10 years ago, I had to go to my girlfriend's wedding and I decided that I wanted to wear a dress, but I couldn't fit into it. So I said, well, I'm going to lose a little weight. I ended up after I got into the dress, but then I lost more weight. So I lost 50 pounds. So then I decided, well, everything I did, I'm going to write a book about it. Do you know that my publisher and my agent, no one would carry it because they said it was, oh, well, you're telling people that they have to eat less and work out and be aware of all the social push to eat, and no one wants to do that. You've got to have a gimmick. So anyway, my book is called The New No Gimmick Diet, and it's
Mhm.
out. You can actually download it for free, a version from our website at healthyamericas.org. If you look at resources and you look at, diet or health, it's there, because there's a lot that we can do, but it's not about willpower because really it's very tough to lose weight. It's even tougher to keep it off. I've kept it off all these years. Well, it's been work. So yes, it's not good to have excess weight, but there's things that you can do, but it's tough. And getting an injection every month for the rest of your life may not be the best answer for everyone. If you want to change the way you're eating, and let me tell you, Martin, I don't gamble, I don't drink, I don't run around, I don't do anything. The one thing I like is my food. I like to
Yes.
eat. But having to cut back on that was really like tough. But the other side is I can walk a lot more, I can be a lot more active. And so there are lots of benefits. And also I'm much healthier because I do it, because I did it. I'll never be skinny. And some people go, well, you lost 50 pounds. You should lose another 50. And I go, you know what? You can take a hike. I'm glad I lost my 50. But I think that's where, we really have to rethink it. And also in many of our cultures, you know, being too skinny is not a sign of health. So we just have to be a healthy weight. And for each person, that's different.
I'm so glad you say that because that's really interesting to me. So, immigrants enjoy doing two things. I spend a lot of time with immigrants, and there's two things that I've seen is common across the board for all immigrants. One, we love to spend time together, and when we spend time together, we eat a lot and drink a lot. Okay, so you don't drink, which I really admire, but what are the effects of alcohol on a human body, and how does it affect our mental capacity?
Okay, so two things. First of all, for Hispanics, alcohol for us, liver disease is one of the 10 leading causes of death for us, not for other communities. And part of it in Spanish, People will say, ay, me duele el hígado, which means, oh, my liver hurts. But in English, people don't say that. So obviously, through the ages, people knew that something was wrong with our liver. So how it metabolizes alcohol is not as efficient as other people. So just as a get go, and because of that, you find Hispanics are more likely to have uh, metabolic diseases due to liver problems. So that's one thing. But the other thing about alcohol is that alcohol is something, it's a toxin. The reason, up until recently, the American Cancer Society used to say, well, you can have one drink or two drinks. And now the American Cancer Society says it's best not to drink. Our bodies are now processing so many things that are toxic, from plastics to endocrine disrupting chemicals to all sorts of things, that when you add to it through alcohol, it just exacerbates it. So it's better not to drink. The same thing is, I don't drink alcohol. I also don't drink sugar sweetened beverages, because we know that sugar, it's not about diabetes, it's about heart disease. So it's just, we have to understand that the WHO, the World Health Organization, has said that you should have no more than 8 teaspoons of added sugar a day. 8 teaspoons is very little. That's only 32 grams. So I think that part of it is really have to be in my book about the new no gimmick diet. One of the things I talk about is the role of sugar in everything we do. And so what we drink is very important. Drink water. Water is good for you. And your body is mostly water, so it has a lot of benefits. So don't, people should eat in moderation, drink water, and avoid the things that are not healthy. If I told you, don't stick your finger in a socket, you'd go, well, Jane, I know that. Well, don't drink alcohol to excess, or try to avoid it, because that can kill you too.
Very interesting. Very, very interesting. So, Dr. Delgado, I just want to say thank you so very much for making the time to come to the show today. We truly do appreciate your time, and we do appreciate you making the effort to speak with us. Ladies and gentlemen, we have been speaking with Dr. Jen L. Delgado. She is a trailblazing immigrant and pioneer in healthcare, public policy, and mental health advocacy. As president and CEO of the National Alliance for Hispanic Health, she has dedicated her career to eliminating health disparities and empowering underserved communities across the globe. With a PhD in clinical psychology and a Master of Science in urban and policy sciences, Dr. Delgado has played a key role in shaping groundbreaking reports like the report for for the Secretary's Task Force on Black and Minority Health. A renowned author of the Buena Salud Health series, she has continued to be a fierce advocate of accessibility, cultural competence, healthcare, making her one of the most influential Latina leaders in the US. Dr. Delgado, thank you for making the time. Before we sign off, what more time, how can people get a hold of you, and how can they get some of your works like your book on weight?
Well, they can talk to me by sending emails to jdelgado@healthyamericas.org. They can get health information by calling 866-783-2645 or 866 Su Familia. And of course, they can get our health book, also a book on depression. Both are free and they can download. I mean, if you want to get a book, you can get it on Amazon, but I think free is good too. So you can download it from our webpage, healthyamericas.org.
Dr. Delgado, thank you so very much. I am sure the next time we're coming into DC, we'll reach out to you. That way we can get to share a little bit and see if we can shoot another episode. We appreciate your time today.
You're welcome. Take care.
Let's talk soon, Dr. Delgado. Thank you so much. Bye bye.